In this chapter, we're going to talk about healthcare and some of the basics of it. Now, keep in mind as well that how we talk about it for the rest of the United States is going to be a little bit different than it is um, for the state of Hawaii. And so, towards the end of this lecture, or kind of when I see it appropriate, um, I'll go off on a tangent just to talk about um, the nature of healthcare insurance in this state. So, the reason why healthcare and health insurance gets at least an entire week of our course is because um, in the United States, it's the thing that we spend a great deal of money on, not only in terms of our GDP, close to $1 in 5 um, spent on healthcare, but also because the government, be it the state or at the federal level, that's half the budget. So it's a lot of money towards going going towards ensuring that we live to see tomorrow. So let's just review again. I know I've talked about these already, but let's just review again what these the large government programs are that are taking up the bulk of the government funding. We've got Medicare and Medicaid, and then it should also be noted too that you can take on both Medicare and Medicaid in a program called Quest. So Medicare is the insurance um, system, the insurance system for healthcare for those over age 65, or you can be under age 65 if you qualify for Social Security disability, or if you have end stage renal disease. Um, on top of that, we've got Medicaid. Medicaid would be insurance for the poor. Medicaid um, benefits become a little bit more generous if you are a pregnant mother about to have obviously about to have children. Um, and again, you can be both old and poor, and then you qualify um, for Quest, which is a system that's different across states. Here in the state of Hawaii, um, you Medicaid covers the Medicare premiums. So the Medicare has a Part A premium, a Part B premium, um, and then there's a Part C if you don't use A and B, and then there's Part D. So in Part A, Medicare Part A, that's hospital. Um, Covers you if you're old and you're using the hospital. As an old person, you don't pay any premium for that because it turns out you've been paying for that your entire working career. If you were to look on your pay stub, you'll see a line that says Medicare, and that would be what you're paying for towards Part A. Now, we know that old people don't just get their care at the hospital. Instead, they go see a doctor. They have non-emergency surgeries, all things like that. Um, that would be Part B. Um, Senior citizens today pay about $170 a month for Part B coverage. And that Part B coverage allows you to see any Medicare accepting doctor, which is almost every doctor. And Medicare pays 80%, the old person pays 20%. Pretty simple. Um, then, about 30 years ago or so, um, Medicare, the people that run Medicare realized that maybe private insurance companies could do it cheaper. So they created what's called Part C. And so what a person would do is they would pay their Part B premium, but they no longer have to pay the 20%. Instead, they go through a insurance company, and that insurance company covers chunks of the bill. If we were to look at it for Hawaii, it's called Akamai Advantage. These are called Advantage plans. So basically, you would pay your Part B premium, the $180 a month, and then you basically have to go to an HMSA doctor, which is pretty much on these islands every doctor, and it covers everything that Medicare covers. It's just that you have to use HMSA doctors. Um, and you can see here you can use them for both Medicare and Medicaid. What's called Quest. Just want to see if it just tells us. Yeah. So for the kind of the basic Part C plan, you'd pay $0 a month, and let's see what it covers. Looks like it covers, basically after you pay the first $275, it looks like you don't have to pay 20%. You just pay $30, or you just pay $50 to see a specialist. But you don't have to pay the 20% anymore. You just pay these flat amounts. And then you get some other things as well, like vision coverage and things like that. And then there is Part D. Part D is prescription drugs. That was started about 20 years ago. So where's all the money coming from for insurance? Well, most of it, that's not government. Because even in the United States, where we like to say we have a market-based healthcare system, half of the money is coming from the government. So the other half is coming from the private sector in some way, shape, or form. And that would just be through private insurance. Now, this is a little bit different in Hawaii because in Hawaii, we basically have a duopoly, meaning that there's two insurance companies that dominate the Hawaiian market. That would be HMSA, which has about three-fourths of the participants, and then Kaiser, which has the other fourth. All the other ones you see on TV, like UHA and other things, those are just like they're minor players. Now, this is counter to the mainland, because on the mainland you get like United Healthcare, you get Cigna, you get all the various Blue Cross Blue Shield plans that exist. Oscar, which is this kind of cool electronic digital one. Um, we don't get that here in Hawaii. Ours is pretty simple. You either pick the managed plan that's Kaiser, which means you have to stay in a very narrow Kaiser network. It's the only Kaiser doctors. Get your prescription from a Kaiser pharmacy. Unless you have an emergency, you're going to Kaiser. It's generally cheaper as a plan because Kaiser is both the deliverer of the healthcare and it's the insurance company. So it's a little bit of an odd role. And then you've got HMSA. HMSA is the biggest on the islands. Um, and because they are the primary, um, they're the most important player on the islands in terms of insurance, they get to dictate what what the coverage is going to be for most. Okay. And then we have some out of pocket patient expenses. These would be the expenses that either insurance is not covering because the person doesn't have insurance or because there's different copays or whatnot. And where's all that money going to? Most of it goes to hospitals. Um, for emergencies, for specialists at those hospitals, procedures. Hospitals is the big source. Doctors, yes, that's part of it. Research is not very much of it, but basically hospitals and doctors, and you can, if you want to read horror stories, You don't have to go very far. Um, let's see here. There's this kind of cool. Sorry, not bill of the week, bill of the month. Kaiser runs also a health foundation. So look at this. I've already read this story. So this one, the guy I think cut himself like on some implement or some farm implement of some kind, and he was like really careful. Made sure he saw um, the hospital he was supposed to go to, did all that kind of stuff. And for 6 stitches, the ER at the hospital still charged him over $1,000 a stitch. Um, and you can just read all of these horror stories, basically. Um, and they really, truly are just horror stories. Um, Jeez, just read enough of these and it makes me grumpy. Um, it's not that so the hospitals are collecting the bulk of the money, and we know for any of us who've ever had um, received a doctor bill, which is probably all of us. Um, the bills are tremendously large without insurance, and even with insurance, you're just so confusing to read, and you do pay a surprisingly large amount even for simple things. Knock on wood, I've been relatively healthy, but now I've had 3 kids delivered. For something like that, it's kind of interesting. HMSA then basically says to the hospital, in this case Capiolani, hey, a lot of our um, you know customers are insured are going to have their babies here. Cut us a deal. We'll pay you a flat amount. No, whenever one of our um, people that we cover has a baby here, and it turns out to be um, what was it? It was about like $13,000 or $14,000. So insurance makes its big payment, and then um, there's a negotiation. That 13,000 was negotiated down from like 25,000, and then of the 13,000, my HMSA, you know, mine I have a 75/25 plan, so my insurance covers 75%. I have to pay 25%. Actually, this you know, I know we're gonna get to it in the slides, but let's just see what something. So I'm obviously an employee of the state. And one of the things with the Affordable Care Act is that all insurance companies have to offer what's called a SBC, a summary of benefits and coverage. And it's standardized. So you have a pretty consistent way of understanding what your benefits are. Then there's a much larger guide to benefits, which is like hundreds of pages. Let's just click on mine here. I have the 75/25 plan. And so this is what it looks like. You may have seen something like this before. If you haven't, the thing you should really truly do this week is be informed about the coverage that you have if you have it through an employer. Now, if you have Medicaid, right, or you have VA benefits, you have a different structure for yours. And if you're curious, I'd be happy to walk you through what you have so that you are an informed consumer. But it makes it pretty clear, even for someone that doesn't know very much about what these different things are, what I, as the consumer, would be responsible for. So let's just start with deductible. Now it explains what it is. Basically, I have to pay this amount first before insurance even covers anything. And so for my plan here, I have to pay $300 for each person in my plan, but no more than $900 for my entire family. So basically, 3 people meeting theirs, then no one else has to meet theirs. So that happens first. My daughter Went to the doctor today. What did she have? Um, well, she went to daycare and then she threw up, and then they saw that she had like bumps on her body, and they thought that she had a pretty common ailment for any of you who have kids, hand and mouth disease, which is right that a kid gets a bacteria, some sort of infection on their hands, and they stick their hands in their mouth, and then the whole thing spreads across the whole body. Well, the doctor said she doesn't have that, but still, probably met my overall deductible, and we're only in the 27th day of the year, and I've probably already met it for her. Um, okay, so there's that. Then, what I'm told here is that during the course of the year, I'm not going to have to spend any more than $5,000 for each individual in my household and no more than $10,000 as a family. Eh, I meet that most years too. It's just because I have a lot of people, right, in my family, and you know, some are healthier than others. So it is what it is. Now, scrolling down, now this is where it's pretty transparent. Every time I see a doctor, I have to pay 25%, and then my insurance company pays the other 75%. Right. And so, um, and then there's the prescription drugs, which are also pretty standard. Right. And I just have an outline of what they are. What's nice about this is it's pretty standard. Everything is 25% up and down the line. If I go see someone that takes HMSA, if the doctor does not take HMSA, then my insurance company covers much less. Um, the other problem I face if I don't see an HMSA doctor is that there's usually a negotiated rate, and the provider, the doctor, or the hospital agrees not to collect the amount that is negotiated down. A non participating provider doesn't. Um, let's see here. Let me just show you an example here. Sorry, I'm making this weirdly more personal than it needs to be, but I don't mind sharing. So HMSA has a site. Okay. Let's do this one. This was my daughter's well baby visit. Okay, so she had her 9-month appointment. So she went to see Dr. Sia, um, and the price of that visit that the doctor charged was $150. Now, because Dr. Sia accepts HMSA, the agreement between Dr. Sia and HMSA is, dude, we don't charge you 150, we only charge 94.56 if you're a HMSA insured person. Okay, so that's this first discount. Now, had I gone to a doctor that didn't take HMSA, I'd be at the 150 amount. Now, this is the one exception to the 25% rule. So for an adult, you get to go once a year to the doctor for your free annual physical. Well, baby visit, in this case, at the 9 months old, they get to go to the doctor for free. And so HMSA paid the full $94.56. Okay. Looks like here they're thinking they're going to charge me $35, but it turns out they don't. These are just like questions like, is your baby, like, I don't know, smiling when they look at you? Right. They're trying to see, like, does the child have, like, let's say ADHD or some other thing, and they do an assessment. Technically, they charge for it, but I've never received a bill for it, so I'm assuming that'll go away. Let's do one that's more interesting. When I went to the eye doctor, let's look at the eye doctor. I went to get an eye exam. In this case, you see the relevant HMSA discounts. Subtracting those out, I get my eligible charges. And then you see here, HMSA did not pay the whole amount, right? For many of these, they paid 75% of the amount. And then this one, they didn't pay anything. Because it turns out that the one thing that they did here isn't part of my coverage. So I'll have to pay that one myself. I think it's like I don't know, looking at your eyes, seeing what they're doing, that kind of thing. So that one I'll pay out myself. And so then I get my bill, right? Okay. Let's go back to the slides. Sorry if that was too much detail. In the world that we live in today, which is post Affordable Care Act, we live in a world where about 9 out of 10 people are covered by insurance in some way, shape, or form, either from their employer or from the government. Now, the way that the insurance system is structured in the United States, it's historically based. It does come from employers for most individuals. Let's just jump to that slide right here. 181 million people. The vast majority of individuals in the United States get their coverage either from their employer, their spouse's employer, or their parent's employer. Why is that? Didn't always used to be that way. In fact, it only emerged this way in the 1950s, late 1940s, early 1950s. Before that, people just paid for health care out of pocket as they needed it because we didn't have Medicare, we didn't have Medicaid. You could buy health insurance, but it wasn't, and the health insurance market was pretty small. People just paid for it themselves. And then because there was such high inflation in the late 1940s, and because there were restrictions on how much wages could go up, employers had to find different ways to compensate employees, but not use wages. So what they did is they offered health insurance, and they paid a portion of it. And that's how we got the system that we have today. It was only in the 1960s that Medicare and Medicaid emerged. So, why do we have insurance? Well, it's the responsible thing to do. I mean, that is the one thing we could say about it. The big reason why people would buy health insurance is you just don't know. You just don't know what the future holds. So, because there is some degree of risk aversion, and you never know when you're going to break a leg or something, or get diagnosed with cancer, you pay an amount, and the insurance company will cover you for any losses. What it does as well is it spreads the risk across a pool of individuals. So in my case, as a state employee, um, I've got a pretty big pool of workers that are all of various ages and various healths. Um, Almost every year without fail, well, certainly every year without fail, I get more in benefits, healthcare benefits, than I pay out in premiums. But it's also the case that, right, so I pay part of the premium and the state pays part of the premium. Let's look at that. Sorry, I'm making this just about me, but you can. And if you want to know how to understand it for your own, I'm happy to walk you through what it looks like for yours. So in my case, every year, once a year, I'm presented with this. Um, it says here, so basically, for my plan right here, I cover my family. I have to pay $207 a month, but that's only a portion of the total cost of the insurance because my employer, the state, puts in another $1,100. So my total policy for my family costs $1,300. Multiply that by 12, right? And we're saying the insurance company is hoping that I'm going to generate less than $15,000 in claims a year. Most years that's not true for me, for my family. Again, it's more of a size issue. Not no one's really unhealthy. It's just a size issue. Um, but what I'm relying on is the fact that there's enough, let's say, single people that aren't using this much in coverage. There's enough, couples out there that aren't using this much in coverage. There's enough families that aren't using this much in coverage, such that HMSA breaks even at the end of the year. Kaiser has a bit of a different challenge because they're both delivering the health care and they are insuring. So they can put in a little bit more protections, a few more protections, but um, they generally, as a whole, they make a little bit less money because HMSA can both get more premiums from the insured, but then they can also to doctors say we're not going to pay you as much as we used to, and if you don't like it, then dude, we're the biggest ones in Hawaii. So if you're no longer an HMSA doctor, you're going to lose a lot of customers. So, not that I feel bad for doctors, but doctors do have it a little bit difficult because they have to accept this. Here in Hawaii, the controversial thing that HMSA is doing is they are um, when you pick a primary care physician, um, the physician is getting a set amount per month to basically take you under their control. And whatever they do for you, no matter how many times they see you, the procedures they do, all that kind of thing, doesn't matter. The doctor just gets a set amount per month. So the doctor, in some sense, can't shortchange your care, but they certainly have an incentive to, not an incentive, but they're certainly being taking on the healthcare cost burden off of HMSA's hands. I've already talked about this, so I'm just going to skip over this part right here because I've already talked about it. And then again, just to be clear, in Hawaii, this distinction is pretty easy to understand. HMOs, health maintenance organizations. These are plans where you can only see a certain set of doctors that are basically direct employees. So Kaiser doctors are employees of Kaiser, the company, and you can only see Kaiser doctors when you have Kaiser insurance. Again, unless it's an emergency. Kaiser, if you need to see a specialist, Kaiser will refer you to another Kaiser doctor who specializes in that thing. There's nothing wrong with that. It's not like it's subpar care. It's just for anyone who's ever, and I had Kaiser when we first moved to the islands. It's fine here on Oahu. You just gotta go to Moanalua basically if you need a specialist. Otherwise, you might get local care at Pensacola or wherever, or Mapunapuna. Um, and you go to a Kaiser pharmacy, all is well. The copays are pretty low. It's no surprises. Everyone knows your medical records because it's all centrally stored. Now, with HMSA, you have to technically you need to kind of look and see, does the doctor take HMSA? It'd be highly unusual that a doctor not take HMSA, but I'm sure there are some out there. Um, and so this is what's called preferred provider. That was the case again where HMSA pays most of the, like 75% of the bill if I see their preferred provider. If I don't, HMSA will still pay it, they just won't pay that much. Mini meds, that we don't have those in Hawaii. Those are illegal. The other thing that's illegal in Hawaii, that's Hawaii specific, is we do not have what they have on the mainland called high deductible healthcare plans. In a high deductible healthcare plan, you're typically responsible for the first $10,000 in coverage. And then the insurance company covers what's remaining after that. There's also there's a thing that's not, there's two exceptions to this. Yeah. There is this thing here in Hawaii. I know they have like a clinic at Al Moana. You basically like join it's not insurance, but it's like a club basically. Um, you become a member of the club. Not even sure how much it is. So you can get a 6 month plan, or a month plan, a 6 month plan, or a 12 month plan. I'm guessing it must be based on how old you are and things like that. But it's not exactly insurance. Notice how they're using the word membership, because insurance, if it was insurance, then they would have to meet certain um, standards with the state, and they are not. They just are agreeing to offer certain services at a lower cost. So it looks like telehealth, looks like some pretty basic things. Um, and then you just kind of pay for you pay a certain amount. I think they also do too, like these like things like they do like advertise. Or it looks like here, okay. So $10 a month or $96 a year. So it's cheap, but again, you're not, if you need an emergency or anything, this is not providing the coverage. The other thing is somewhat controversial. Um, let's see, what is that called? I just share. So this is one where it's not insurance, but um, and keep in mind I'm Catholic, so it's not. I'm not trying to dismiss what their thoughts are here, but I'm trying not to be dismissive of it when I talk about it. But I kind of think it's a little bit of a scam. So, all right, health insurance can get pretty expensive if you don't have an employer that's covering it. So, what do people do? Are they just going to go without? Most people don't want to just go without. So people try to find a way to get coverage cheaper. That's where this MetaShare type of thing comes in, which was a way for an individual to basically join, in this case, other Christians, and the Christians all together share in the healthcare costs. Um, the reason why I'm not trying to be dismissive, but the reason why um, it's not to be relied upon is that there's no obligation of MetaShare to cover something. It'd be if they want to. Um, and an insurance company is required to. If there's a legitimate claim, they have to cover that claim. And if they don't, they'll get sued. Not the case with Medishare. I'm not even, I've never, no, I'm going to get Google ads for this all the time. Jeez, I'm not even, I don't want to even see my pricing. Let's look at the summary of sharing. So it looks like I'd have to pick how much is the sharing option. So I share some of the cost. It looks like they'll share up to $100,000 a year coverage after 3 years. I mean, if you got nothing, this is better than nothing, but um, this is not insurance. So, how does Kaiser do it? How does Kaiser, um, how does Kaiser do what they do? Um, for Kaiser, um, they use gatekeepers. So the your primary care physician, as the gatekeeper, is the one that ensures that um, is the one that ensures that you don't um, go to the wrong place to get or see doctors unnecessarily. Um, the um, HMOs like HMSA, they also use it, um, but at the same time, um, the HMOs are not as stringent of a gatekeeper as Kaiser would be, because for Kaiser, again, they're both the insurance company and they're delivering the care. So Kaiser's even going to control, or an HMO in general, is going to control things a little bit more um, than a primary care physician at HMSA will. And that's where you kind of see again these kinds of distinctions here. And this is a choice, especially that we all face here in Hawaii, is that we basically face a choice of HMSA, which is the PPO, or Kaiser, which is the HMO. That is the choice we face. When I first moved to the island, you know, the we did Kaiser for the first year. There was absolutely nothing wrong with it. My in-laws use it. They're on Medicare and they use Kaiser for everything they need. And I don't think that the care is any worse. It's just different. The delivery is different. You go through a few more hoops. You can only see Kaiser doctors, so you always know you're going to, a Kaiser facility. There's not a lot of surprises. PPOs, you have lots of choices, but here in Hawaii, those choices can become debilitating if you don't know how to decide which doctor to see, right? Or like all my children been delivered at Kepiolani, right? I don't know. I mean, I suppose I have Queens as an option, but I've never gone there, so I don't know. I'm gonna keep going to Kepiolani. I don't have that choice with Kaiser, right? If I had Kaiser, dude, you know where you're going. Mauna Lua. That's where you're going. And then you get the little song. It's kind of nice. Maybe about the only reason to have Kaiser. Um, no. But my free advice for you would be if you're on an incredibly tight budget and you want to keep your healthcare costs the absolute lowest, Kaiser's the way to do it. Because your copays will be the absolute lowest. And you won't get any surprise bills of any kind. Okay. I've already talked about this, so I kind of already spoke ahead about the Medicare program. We have Part A, again, premiums paid as we do throughout our working career. Part B, you have to pay the premium of now about $170 a month, and Part B covers 80% of the charges. You cover the other 20%. And then we have Medicaid. We live in a state, the state of Hawaii, that covers um, uh, we have what's called, we're an expanded state. We um, expanded Medicaid coverage to those who are working but are still poor. In other states, if you have any kind of job at all, you are not eligible for Medicaid. But here in Hawaii, you can have a job that pays very, very little, and you would still get some coverage. Now, Medicaid is paid for by the states and by the federal government. It's kind of a joint thing. Medicaid generally takes up the bulk of a state's budget. It becomes one of the most expensive things that the state is providing. The fun fact or unfun fact, depending on your perspective, is that after COVID, this percentage has grown quite a bit. Okay, so here we can see 2015, it was 15.1%. But this was, yeah, I'd seen this article, so that's what I'm thinking. Is your portfolio okay. So look at that. Half of all children in Hawaii on Medicaid. That's depressing, right? I mean, this is last year, so this is during COVID. Um, Look at this. So 257,000 people in Honolulu are on Medicaid. That's out of what? Just under a million people. It's one in four. It's pretty bad. Um, Pretty bad in the sense that, again, if you didn't listen to my earlier lecture about it, for any of you that have ever been on Medicaid, this is not I mean, it's healthcare coverage, and there's nothing wrong with just having some healthcare coverage, but it's pretty bad. It's bad for doctors because they get reimbursed so little, but it's also bad for patients because it's so difficult to find a Medicaid accepting doctor. You get some. What's the clinic? Comprehensive healthcare on the leeward side. Um, I think it's Waianae Coast Comprehensive. Yeah, they have a clinic in Nanakuli, but I think they also have, yeah, they have some others on the leeward side. Um, I mean, I've never been there, but um, it's designed to meet the needs of those who are Medicaid eligible, for instance, as well as have other kinds of coverage. And this is all designed to be for those on the leeward side of the island. But it's a um, it's difficult, right? Um, this is not a place that's designed to make a lot of money like a Kapiolani or a Queens. This is just doctors, providing the needed healthcare coverage. Now, this seems like a perfect time to introduce what the system, what the program is in Hawaii. So long before we get the Obamacare, or what's more formally known as the Affordable Care Act, Hawaii is a special place. It truly, truly is. And I mean that. Because In Hawaii, we have the Hawaii Prepaid Healthcare Act, which was passed in 1974. 1974. And what it did is it created in the country, in the United States, the very first employer mandate. And what it did is it required employers to offer employees health care coverage if they were employed for more than 20 hours a week for 4 weeks in a row. Even Obamacare, which was passed, decades later, that's not even as generous because they require, as you see here, 30 hours a week. And it's only if you're a big enough employer. In Hawaii, as long as you're not a self proprietor or a government employee like me, um, there's no such thing as an employer not offering health care coverage. If you are employed by a large enough company with more than a few employees and your employer is not offering you health care coverage, dude, send me an email. Not that I want to narc for you, but they shouldn't be doing that. Every employer has to offer health care coverage if you're working more than 20 hours a week for 4 weeks in a row. Additionally, the employee never has to pay more than 1.5% of their wages as a premium, and they would never pay more than 50% of the premium cost. If I look at these like really fancy plans that I can buy, even me as a state employee, they try to stay with it more or less. But even these like very generous plans, they get pretty darn close to that 50 percentile. Okay. Um, what it did, because of Hawaii passing the Prepaid Healthcare Act of 1974, it meant that Hawaii went from having 30% uninsured before the law was passed to having a 6% uninsured rate. That's just amazing. The net result is that there's not very many people in Hawaii that don't have healthcare coverage in some way, shape, or form. The Affordable Care Act or Obamacare did the same thing, it just did it nationwide. If you're working 30 hours a week or more, the employer has to offer coverage. Now, the coverage can be shitty. It can be a high deductible healthcare plan that can be very expensive. Do I have any examples? I don't know. I'm just going to search. I'm just sure they're not going to offer it. Let me see it very easily, but let's just see if they do. Yeah, it looks like they want me to log in or something. Let's see. So basically, if the mainland company wants to operate in Hawaii, they have to offer HMSA. Otherwise, they're all going to use United Healthcare. Just give me more details. It really doesn't. Oh, the mainland's a little bit. I mean, I'll be honest. If some of you are preparing for a career on the mainland is much scarier in terms of healthcare coverage because you are basically paying for more of it beforehand. Okay. Um, so why is this so expensive? Well, the problem is that first the kind of care we're receiving is all is better, but also it's just you never know what the bill is going to be. Each child I've had, dude, it was a mystery what the bill was going to be in the end. This last one I just had, I didn't pay anything. For the very first one, I think I paid like $2,000 or something. The middle one was kind of in the middle there. Um, it just really depends, right? It's just a lot of uncertainty, and that's just for a simple normal delivery of a child. Imagine if I had to get like an MRI or an X-ray or a CT scan. Again, you don't know who you're all going to be encountering to get that procedure done, and then even what the cost of it's going to be. And you can't really ask any questions because you just need to get the care. Again, I'm not going to cover the graphs. Um, in general, um, one of the things that is illegal in Hawaii, but is legal on the mainland, is the use of third party payers. Um, this is a bit controversial. So, one of the big costs, for instance, for Medicaid is dialysis, right? For people who have diabetes. And if they're on dialysis, that's a very expensive procedure that has to be done, a few times a week. Now, Medicaid covers it, but they don't pay very much. So, what companies do on the mainland is that let's say I run a dialysis company, and like I notice that Ernie has diabetes and he goes to my dialysis clinic 3 times a week, but he's on Medicaid. So I'm getting like, I don't know, $50 every time he comes. I'm like, dude, Ernie, what if I paid for you to have an HMSA plan? Now you might be asking yourself, why would Scheiding, the owner of his dialysis business, why would I pay for Ernie's HMSA plan? Let's say, and it costs, let's say, $500 a month. Why would I pay $500 a month? Because if he has if he has HMSA might pay me $200 for every visit versus Medicaid that pays me only 50. So I only need Ernie to come to me a few times a month for that whole investment to pay off. Well, HMSA got wise to it, and they don't allow it. Um, they do not accept premiums from Tom Scheiding, the dialysis company. Um, Basically, HMSA realized this is really increasing our cost. And as they do say that here, conflicts of interest skew the health coverage risk pool and adverse selection. I actually kind of agree with them. It's a sneaky way that those dialysis companies were trying to make more money. Um, the thing that healthcare companies also try to control for to some extent is moral hazard. They want you to do good things, things that will make you healthier. So right, like I think with my healthcare plan is like, yeah, they'll pay you to go to the gym. If you want to stop smoking, they'll pay for the patch and stuff, um, to make you a healthier person. The one thing that um, changed under the Affordable Care Act was that pre-existing conditions were outlawed. So it used to be the case, and I do remember this, um, that if you got new healthcare coverage, the healthcare company would not pay for any type of ailment you had before you had the coverage. So let's say I had cancer, right? And cancer can always come back. But let's say I was fully treated and I was all good, and I get coverage. Well, the insurance company before the Affordable Care Act, the insurance company would say, "Dude, we know you have cancer. You were already diagnosed with it. We're not going to cover you for cancer anymore because you already had it. And so we already know we're only going to cover you for the future unexpected diseases you might have." Well, that was outlawed. And that's good that they did that in the sense that, it makes it difficult for the sick person to get coverage, to do the right thing and to have healthcare coverage if they, can't get simple things paid for. The other issue we have with insurance that can drive prices up is adverse selection. So adverse selection would be is this notion of what kind of person will seek out health insurance. The answer is the unhealthy. What the Affordable Care Act tries to do is it tries to avoid that problem by making it a requirement that everyone has to have the coverage. Um, Technically speaking, you're supposed to pay a fine, I think, to the IRS if you don't pay if you don't have health care coverage, I think. And so that's what we see with this mandation right here. Um, there's some other things that the Affordable Care Act did, which actually did make the system better. And remember, we're only about 10 years into the Affordable Care Act. Um, One is that kids are covered until they graduate from high school or college if they just decide to go to college. Um, uh, we don't have lifetime limits anymore. So it used to be you could have like $100,000 lifetime limit that you would ever get um, for coverage. Now that's no longer the case. Everything is unlimited. Um, Men and women pay the same prices. The government really doesn't get involved in setting the premiums or the profit levels or anything like that. So before you listen to someone say that Obamacare means that Obama was trying to take over the health insurance industry, not the case. Actually, all that the Affordable Care Act does is that the government subsidizes the premium that's paid to the insurance company. So that's all that's happening. The government doesn't get involved in anything besides setting up the minimum benefits under the Affordable Care Act. So, for instance, maternity coverage is always provided, a wellness visit, always provided, mental health benefits, always provided. And you get these same kinds of things here. Okay. This lecture's gotten pretty long here. Let me just finish it by talking about what does the rest of the world use. The rest of the world uses, for the most part, uses what's called a single payer system. And under a single payer system, basically the government usually collects taxes. That's basically the premium. And then in some cases, the doctors are also government employees, and in some cases, they're not. And that's what you kind of see here. Um, so it's not free health insurance. Canadians don't get free health insurance. The British do not get free health insurance. No, they pay a pretty sizable tax. How much? I'm actually unsure. National Health Service amount. So the British are paying Mm, about 20%. So basically, imagine oh, here we go. National insurance is currently about 13% of wages up to a certain amount. So it's not free. I mean, this is what I'm just trying to say here. It's not free. Um, so British here. Now the doctors are all public employees, and so the British pay their premiums to the government, and then the government hires the hospital, builds the hospitals, hires the physicians to provide the coverage. Canada, the employers pay a pretty sizable portion to the government. The government provides the coverage, but the hospitals and the doctors are private. Let's take those extreme examples. The problem with government healthcare, the common complaint, which does have an element of legitimacy, is that you wait a very long time to get the coverage that you need to get seen. So here's your example. My first son, Truman, again, I got lots of kids, and so and just kids get sick all the time over little things. I think Truman was 6 months old or 9 months old. My wife, um, she had a work assignment in London. Like an idiot, I said, "Oh, sure, I'll come along and I'll bring Truman too." So we all went there. I don't know. Truman sticks his hand in something. I don't know. Somehow gets pink eye. So he's got this big pink eye. He's my first kid, so it's like we weren't that wise about what it looks like and how to take care of it. I'm sure we would have been less worked up now than we were back then. But the kid's got this eye that looks like this, and you're in England. It's a Saturday, and you're like, well, fuck, how do I take care of this problem? Um, I did it pretty much the only way I know how from all my time in Mongolia, which also has a nationalized healthcare system. As I told my wife, let's just go to the doctor. So we go to the doctor's office. They have you filling out all these forms, and they're trying to tell you which office you can go to and when you can get seen. And even though we don't have the National Health Service, the NHS, they'll still see anyone. But you had to wait a really long time, and we weren't staying in the country that long, and I didn't want to spend my vacation doing that. So now this seems bad when I say it, but there is a purpose to what I'm saying here. Um, is that I didn't want to wait in the long line for the healthcare. I just wanted to get him seen right away so I could just go back on to living. So I just said, what would it take to, um, for him to get seen right now, right? And there was basically because of the way I asked it, I was told if I pay this separate amount, I can get seen right away. And sure enough, I paid in cash, US dollars, no receipt. I got seen right away, and he got what he needed. Um, it's unfair. And so I'm sorry, British children who also had pink eye that day. My child's got in front of the line just because Daddy Warbucks here paid the money. But that is the problem. People wait an incredibly long amount of time in Canada to get very simple procedures done. Let's just look. I don't even know what it is here. Robot maze. Let's see what it is. Yeah. Okay. Well, I'm just going off of Wikipedia here or whatever. 3 weeks in the U.S. to wait for a knee replacement. 8 weeks in Canada. Mm. Oh, I got another example. So my father, who was career military, he he's retired now, but he had cataracts. A very simple eye procedure, um, and he gets all of his coverage from the VA, which is basically government healthcare. and he had to wait. I think it was like 2 or 3 months to get his cataracts removed. Whereas if he'd gone to a private hospital, it could have been the same week. Um, so you wait longer, but it's cheaper. Now, all of that discussion shouldn't say though that the healthcare outcomes are any different. In fact, what we see is that we spend more than these countries listed, yet we have worse healthcare outcomes. We have more infant mortality than the rest of the world. In fact, in the Western Hemisphere, we have the highest infant mortality. The highest. That's just shameful. Because what does infant mortality represent? That represents that we as a society didn't provide the mother the needed health care coverage and support she needed while she was carrying the child. And then once the child was born, we didn't provide the needed support to ensure that that child survived and thrived. And we're just failing at that. And then also the life expectancy is lower. So we're not doing enough for the elderly. Medicare is covering expenses, but the coverage might not be as good. And plus, over the entire lifetime, an individual may have not had consistent coverage in the United States. On the other hand, if you got a problem worldwide, US is the place to go. Cancers up and down the line, highest survival rates for the most part. Because we just have expensive healthcare coverage that can cover what is needed. Okay. For this rather long lecture.